Welcome to the third episode of the DC Perinatal Voices podcast, hosted by the DC Perinatal Quality Collaborative, where we spotlight the members of our community and hospitals to share about programs, stories, and resources to improve maternal and infant health outcomes in the district. I'm your host, Yolette Gray, Senior Director, Maternal and Child Health Initiative over the DCPQC. Today, we are excited to be joined by Janille Thompson. Janille is a public health professional with over 15 years of experience in nutrition education, health promotion, and program management. She provides families with essential resources and fosters connection that help them thrive. Thank you so much, Janille, for joining us today. How are you?
I'm well, Yolette. Thank you so much for having me.
Yes, we are thrilled to have you join us, and thank you for making the time to be here. Before we dive into the conversation, can you tell us a little bit about yourself, a little bit about your background?
Sure, I'd be happy to. My name's Janille Thompson. I'm a native Washingtonian, and I am the mom of three boys. Their ages are 13, 7, and 4. And we currently reside in Ward 7, east of the river. And I enjoy living in Washington, D.C. I've been here my whole life, aside from leaving for college and grad school. And I really enjoy spending time with my sons and exploring the city.
That it's awesome to hear. Three boys, my, you must have your hand full.
For sure.
Definitely. I only have two girls, so I know it's a lot of work. So with the demand of being a professional, a mother of three boys, what do you like to do during your spare time?
Yes, well, I enjoy a lot of things. One being I'm a nature girl, so I love agriculture and farming and farmers markets. So I love the sense of community as well. So I will do things like volunteer at in Ward 7 at the Letterer Gardens Farm. I also take my boys to a lot of community events related to agriculture in the city. And for myself, I love to shop, bargain shop. So this includes thrifting. And I also love to dabble in cooking, using those fresh fruits and vegetables that I will purchase at the farmer's market. So in the midst of being a busy mom, I do find time to do things for myself for sure.
Oh, that is awesome to hear because a lot of time what happened is we take care of the kids and we don't take care of ourselves. So I'm so glad to hear that you are putting some time, some self-care time for yourself as well. So let's go ahead and dive in a little bit into the work that you've been doing with the DC Perinatal Quality Collaborative. Can you tell us about your experience so far working with the DCPQC?
Sure. I've been involved with the DCPQC for a little over 2 years, and it's been a great experience. I came on to participate in a focus group, and I've kind of been with them since then, and it's opened up many great opportunities for me. I've sat on two different panels. Last year, I sat on the DCHA Summit panel with some very great public health professionals in our region. And this past August, with the DCPCA, I participated in the Maternal Health Dream Team for the symposium, and that was an awesome experience as well. So I've been able to network and learn not only from the community, but some of the greatest maternal health specialists and colleagues in the nation. So it's been a very rewarding experience for me.
So glad to hear that. We do like to keep our patients busy and involved and expose them to not just the work we are doing, but also some of the external activities that are happening. So I'm so glad to hear that you've been taking advantage of those various external activities that we provide in the district. Do you mind briefly sharing your story with our listeners? How was your prenatal care? Changes you notice in your body? And can you explain to me how your delivery experience was?
Sure. Well, I had three children. I have three children and three different delivery experiences. So with my first child, I ended up having an emergency cesarean. All went well, but as far as that was my first time being a mom, so I learned a lot of things about my body, just how awesome women are to be able to carry a life and birth a life. But I was young, and I just noticed the changes in my body, just my body stretching, my body growing, just feeling the baby move. It was a very surreal and very rewarding experience. There's, some hard sides to pregnancy, but fortunately, I didn't experience a lot of that, like nausea, morning sickness, and things. I just experienced more of the transformation of my body growing, me gaining the weight to nourish and prepare for the baby. So it wasn't a bad experience at all. But as I became pregnant a second and third time, I had two different experiences. They both were cesareans as well, just due to my medical history. But I had a really great care team that took care of me throughout each pregnancy. And so that was the plus on my end, to be able to have healthy deliveries with minimal complications. So I'm very thankful for that.
Oh, yes, for sure. Throughout the prenatal care, did you feel prepared for your delivery?
I did. With the first child, it was just a new experience. So I did not feel prepared when it came to the point of me having to have an emergency cesarean, because that was just the way my body was working. My son's head was too large to come through the birth canal. So I had to have a cesarean section, but that was okay. As I got pregnant the second and third time, I feel like I was much more prepared because I knew what to expect. I knew that I was not going to have a vaginal delivery. And I did have a new provider with my second and third pregnancies, and we built a very great rapport. So I was super thankful for that. Everything worked out well. So I feel like, as a first time mom, speaking for myself, it was, I didn't really know what to expect. But as I, had my second and my third child, it became easier. And I was more aware of the changes in my body, or when it was time to have the glucose test, and, just going through the whole time of pregnancy. It's a long time, where you carry the baby and your body goes through many changes. But I began to learn my body and take notes, and I would go to my appointments with a folder, with questions, just to make certain that everything was that I felt well. And so that was my strategy to ensure that everything went well, as time went on throughout my pregnancy cycle.
That's great. You mentioned on two things that I'd like to touch on just a little bit. You mentioned on your relationship with your doctor. How would you describe that relationship with your care team, your provider?
Oh, it was a really excellent relationship. We built up a rapport. I actually kind of fell into my provider. I came to the office with a challenge, and he helped me through that challenge, my OB. And then when I became pregnant with my second child, he helped deliver that child as well. And we built that rapport up, and then as well as the third. So with anything with relationship building, building a rapport takes time, but I felt comfortable speaking with him. I felt safe. I did not feel like I was rushed, and all my questions were answered. All my appointments were taken down. I was able to see him, and he was able to be with me on my journey throughout both of my pregnancies. And so I would email him through the portal, just asking questions, making sure everything was great as far as, the changes in my body. And, because every pregnancy was different for me. And so I just wanted to ensure that I was healthy, the baby was healthy. And as long as there wasn't an emergency, I was able to email and communicate with him through the portal. So upon building that relationship up with the second pregnancy, it just continued to flourish throughout the third. And it was just a really great experience because, I trusted him with my life and my baby's life. And thankfully, all is well. Everything went well. And those two children are 7 and 4, thriving and happy. So it was just a really good experience because I entrusted him. And, he took the time to listen to me, to listen to what I needed to thrive and be happy throughout my pregnancies. And we definitely succeeded. So I was very thankful for that.
Yes, and so many individuals who are going through this experience, they don't experience such positive, and again, even you on your end, your first delivery was not so positive, but it
Mhm.
seems that you had identified a provider who listened to you and who walked you through that experience. Can you tell me how easy was it, difficult, or how easy it was for you to find another provider after your first delivery?
For me, it was simple. There was a whole team of providers, and since I originally went to my OB, I made an appointment with her, and she was unavailable, so I ended up with the provider that delivered my youngest two sons, and so I stuck with him because he took the time to care. He explained my minor concern. We came up with the solution, and we went from there. So it was not a difficult process, and he just kind of fell in my lap gratefully, and it was a great experience. But it was not difficult at all to find an alternative provider, as the hospital had a whole team of OBs that a patient could choose from.
That's so good to hear. So good to hear. Is there anything else you would like to share with our listeners? How important is it to build that relationship? You had such a great experience. You were able to build relationship with your provider so that your second and third delivery went well. Anything you would like to share with our listeners around how important it is to build relationship with your provider or your care team?
Sure, definitely. I would like to encourage your listeners to know that just to advocate for themselves and know that you can ask questions, that you can take the time, be prepared with when it comes to your appointments. Have a list of questions to ask your provider and build that rapport, build that trust up. And if you feel as though you're not comfortable, speak up and see if you can see another provider, and maybe you may gel with him or her better than the last provider. So it takes time to build that relationship, but just always advocate for yourself and always ask questions, and be prepared, because you want to ensure the health of yourself as well as your baby and ensure a healthy delivery. That's the outcome that we want to happen. A healthy mom, healthy baby, makes a happy situation, a healthy family, not forgetting dad or the partner. So just being prepared and self advocating for yourself is very important to ensure happiness throughout pregnancy, prepartum and postpartum.
So good to hear. Yes, definitely. We do want to make sure that the partner is involved as well, the family. I like what you said. Healthy mom, healthy baby, healthy family. That is well said. Janille, we are coming to the end. What advice would you give to a new mom who is navigating the system and looking for a care team?
Okay, great. I would encourage a new mom to do her research. We're in a digital age where she can do a Google search on the facility. She can pull up the provider's bio, see where they attended school, what they specialize in as far as women's health goes. And they can ask family and friends, like, oh, hey, do you know of a good OBGYN? Which hospital did you deliver in, or did you have a home birth, or did you go to a birthing center? There's so many different avenues. There's some women that go the doula route and the midwife route, which is no problem, but everyone has preferences, and different experiences. So I would encourage them to do their research by on their own, and then and then also asking family and friends to assist, and going with the route that's most comfortable for their family, for their partner, and for themselves. So it takes, again, that self advocacy piece, doing the research and putting in the work. It's going to take, work to ensure that mom is happy and the whole family is happy. So just doing that research and tapping into resources, family and friends, it takes a village. And so I would encourage a new mom to tap into her village, whatever her village looks like, to ensure that all is well and that she and her family will be happy.
Great. Thank you so much, Janille, for joining us today. Thank you for sharing your experience, your story. We really enjoy having you as a guest today. And thank you to our listeners for tuning in. To learn more about the DCPQC, visit us at dcpqc.org and be sure to follow us on Instagram, Facebook, and LinkedIn. Until next time, stay well and stay connected.